When you hear the word rickets, what comes to mind? Probably something out of a history book, right? A disease from a bygone era. But what if I told you that this condition, the one that softens and deforms the bones of children, is making a surprising and pretty concerning comeback, even in wealthy countries? All right, let's get into it. To really understand what's going on, we're going to approach this like a medical mystery. First up, we'll investigate what's actually failing inside the bones. Then, we'll hunt for some of the surprising modern-day culprits. After that, we'll trace the chain reaction inside the body, learn to spot the telltale signs, and finally, crack the case on how we solve it. So first things first, what exactly is rickets? I mean, on the most basic level, what is happening when a child's growing skeleton just fails to harden properly? At its absolute core, rickets is a failure of mineralization. Think of it like this. You're building a brick wall. The bone tissue is the bricks, but the mortar, the stuff that's supposed to make it strong and solid, well, it never hardens. It stays soft. And for growing kids, this is a massive problem because it directly affects their growth plates, the very engine that makes their bones get longer. And here's a really important point to clear up. We call this problem rickets when it's happening in the growing bones of children. But when that exact same failure to mineralize happens in the fully formed, mature bones of an adult, it goes by a different name: osteomalacia. It's the same fundamental problem, just at a different stage of life. And this is where our story takes a really surprising turn. You see, in countries that fortify foods like milk with vitamin D, rickets had become almost unheard of. But now, it's starting to reemerge, which really makes you wonder, why? And who, in this day and age, is suddenly at risk? All right, so if this was basically a solved problem, why is it creeping back into the picture? That brings us to some really surprising risk factors. Let's go on the hunt for the modern-day culprits. And what's wild is that we're not talking about some complex virus or a rare genetic condition here. The main causes are, well, they're shockingly simple. It all boils down to not getting enough of three basic things: sunlight, vitamin D from food, and calcium. That's it. This leads us to one of the most specific and frankly surprising at-risk groups today. Okay, we all know breast milk is incredible for babies, right? But here's the thing. It's naturally quite low in vitamin D. Now, if you have an infant with darker skin, which produces vitamin D from sunlight much less efficiently, and that baby is exclusively breastfed for a long time without any vitamin D supplements, well, their risk for rickets shoots way up. And that's not the whole story. The list of who's at risk today is broader than you might think. We see it in very premature babies, whose tiny skeletons are just growing so incredibly fast. We also see it in kids on unsupervised dairy-free or strict vegan diets if their nutrition isn't carefully managed. And hey, even just where you live matters. If you're up in the northern latitudes with less intense sun for much of the year, that's a major risk factor. Okay, so we've covered the who and why on the outside. Now let's go inside the body and trace the chain reaction. Let's look at the internal domino effect that just one deficiency can kick off. So, let's ask the most important question. Your body needs a steady level of calcium in the blood for your nerves and muscles to work properly. This is absolutely non-negotiable. So, what does the body do when that critical calcium level starts to dip? Well, it triggers an emergency protocol. Low blood calcium sounds the alarm, unleashing a hormone called PTH. You can think of PTH as a repo man for calcium. It goes straight to the bones, the body's calcium bank, and starts pulling it out to keep the blood level stable. But, and this is the crucial part, there's a terrible side effect. PTH also tells the kidneys to just dump phosphate, and you can't mineralize bone without phosphate. So the growth plates can't harden, and boom, that's the chain reaction that causes rickets. Now, all of this chaos happening on the inside, it doesn't stay a secret for long. Eventually, you start to see the evidence on the outside. So let's put on our detective hats and search for the telltale signs, the clinical evidence that something is wrong.
Before we get into the specific physical signs, I think this quote from the medical literature it really hits home. It's a powerful reminder that beyond all the biology, we're talking about children who are often in pain, they're tired, and just generally feeling unwell.
One of the very first clues a doctor might find is something called craniotabes. It's a softening of the skull bones. They say when you gently press on it, it can feel a bit like a ping pong ball.
Next, we have some classic signs with some pretty unforgettable names. The rachitic rosary sounds almost poetic, but it describes these noticeable bead-like bumps where the bony part of the ribs meets the cartilage of the chest. It's a direct sign of those enlarged, struggling growth plates.
And then there's the Harrison sulcus,
This is a horizontal groove you can sometimes see on the lower chest. Think about it. Your diaphragm is this powerful muscle that's constantly pulling down to help you breathe. If your ribs are soft, that constant pulling literally creates a groove. It's a direct physical sign of the weakened bones. And the other visible clues just keep piling up. You might see a forehead that seems a bit prominent. That's called frontal bossing. The wrists and ankles can look noticeably wide. And then, of course, there's the sign everyone thinks of with rickets. Once a child starts walking, those soft leg bones can start to bow under their own weight. Even their teeth might come in late.
But I really want to stress something here. This isn't just about bones. That dangerously low calcium we talked about, it can get so bad that it triggers seizures, severe muscle spasms. It can even weaken the heart muscle itself. And what's really scary is that sometimes these life-threatening symptoms can pop up before the classic bone signs are even obvious.
Okay, so you've gathered all this evidence. How did doctors put it all together and officially solve the case? Let's talk about how rickets is diagnosed, treated, and most importantly, how it's prevented.
First stop is a blood test, and the results basically give you a biochemical smoking gun. Now, you might look at the calcium and see that it's low, or, get this, it might be normal because the body is working overtime stealing from the bones. But the other markers, they don't lie. Phosphate will be low. An enzyme called alkaline phosphatase will be way up, and that emergency hormone, PTH, will be sky high.
But for the final slam-dunk evidence, you turn to an X-ray. Instead of the end of a long bone being a nice, crisp line, it looks blurry and disorganized, almost like the end of a used paintbrush. Doctors call this cupping and fraying, and along with a widened growth plate, it's the unmistakable picture of rickets.
And you know the best part of cracking this case? The solution is so simple and incredibly effective. You literally just give the child what their body has been crying out for, vitamin D and enough calcium. And prevention? It all comes down to education, advising families on diet, supplements when they're needed, and the importance of safe sun exposure.
So that brings us to the end. This is not some ancient curse. It's a preventable disease, plain and simple, caused by basic deficiencies. Yet here we are, seeing it pop up again among some of our most vulnerable kids, and that leaves us with one last, really important question to think about. Are we paying enough attention?